Hi, I'm Emily. I'm going to be doing your physical exam today, okay?
Okay.
I'm going to ask you to do some things and we'll move along as we go, but just let me know if anything hurts or if anything's uncomfortable, okay?
Okay.
I'm going to start with your eyes. If I can just get you to look straight past my head here, I'm going to shine a light into both eyes. Good. Alright. And if I could get you to cover one eye or the other, either one, and tell me how many fingers I'm holding up.
2, 3,
Okay, switch.
1, 3.
Okay, you can put it down. Now if you'll follow my finger. Good. All right. Now I'm going to shine a light in your eye with my ophthalmoscope here. Just look straight ahead. I'm going to get very close, but I will not hit you, okay? Okay. Perfect. Now I'm going to use a Snellen chart. I'm going to hold it away from me. About 6 feet is the one that this one's for. And you can just read, cover up one eye, and read the line that's clearest to you.
L, T, F, P, H.
Okay, and switch. And again, read the line that's clearest to you.
L, T, F, P, H.
Okay, very good. All right, now I'm going to look at your ears. Just going to look in front here. Any tenderness?
No, ma'am.
Okay. You noticed any drainage or anything from your ears?
No, ma'am.
Just switch my instruments here. Okay. Hold your head straight. Just going to look at your eardrums. Okay, good. Okay, I'm going to cover up your ear and I'm going to whisper to you. I want you to repeat what I'm saying, okay? Apple.
Apple.
Baseball.
Baseball.
Very good. We're going to test your hearing today. What I'm going to do is I'm going to strike this instrument. I'm going to place it up next to your head. Once you stop hearing it, let me know and I will move it next to your ear. Once you stop hearing it, then let me know, okay?
Yes, ma'am. No. No.
Okay.
No. No.
Okay. The next test I'm going to do is another tuning fork. I'm going to put it on your head. I want you to let me know if you hear it more on one side or the other or if they're both the same, okay?
The same.
Okay. Now check out your nose here. Any tenderness around your nose?
No, ma'am.
All right, if you can look up. Good. Gonna tap on your sinuses. Let me know if they're tender. Nope. Okay. All right, and if you'll close your eyes for me, I'm gonna test your sense of smell. If you'll close off one of your nostrils, and let me know what you smell here.
Lemon.
Very good. We're going to do the same thing on the other side. And let me know what you smell here.
Peppermint.
Good. Okay. Just gonna check out your head now. You have any open lesions that you're aware of?
No, ma'am.
Alright, and look straight at me. Just gonna fit on your face. Can you clench your teeth for me? Very good. Alright, and can you puff out your cheeks? Good, and show me your teeth. Alright, stick out your tongue. Move it side to side. Good. Can you raise your eyebrows? Very good. And close your eyes real tight. Great. Let me get my gloves on here. We're going to take a look inside your mouth. Just going to look first and then I'll shine a light in your mouth, okay? Open for me. And stick your tongue out. I'm just going to look at your tongue here. Good. And open wide. Say ah.
Ah.
All right. Very good. All right. Gonna touch your neck now. Any soreness whenever I'm touching?
No, ma'am.
Okay. Looking at your lymph nodes. Good. I'm going to step over here and touch the back of your neck. Can you look down just a little bit? Good. And can you look up and tilt your head side to side, ears to your shoulder? Good. And circle your neck around. Very good. All right, let me check out your thyroid here. Good. Just going to listen. Good. Can you raise your shoulders for me? Very good. All right, now I'm going to listen to your lungs. Anytime you feel my stethoscope on your chest, just take a big deep breath in and out, okay? Big deep. Good. I'm going to listen to the other side. Good. I'm going to listen to your back now. Again, big deep breaths for me. One more. Good. Now I want you, every time you hear my feel my stethoscope, to say E, okay?
E. 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 E.
Good. Now I want you to whisper 99. And whisper again for me. Good. And E again.
E. 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 E.
Good. I'm going to have you turn towards me just a little bit, and then I'm going to walk around the back side to assess you some more. Can you say 99 out loud for me?
99. 99. 99. 99.
Good. Take a big deep breath in and let it out. Good. Can you do that again for me? Good. I'll have you say 99 again for me on the front side.
99, 99, 99.
Very good. All right, now you're just going to feel me tapping on your chest. All right, and once again, if you'll turn this way just a little bit. Other way. There you go. I'm going to tap on your back. Good. All right, you can turn back. All right, now I'm going to take a listen to your heart. First there, I'm going to touch your chest. Do you have any tenderness or pain? Okay, good. Okay. You're going to feel me having some different, I'm going to push on the stethoscope some.
Okay.
The stethoscope is tunable, so I'll be able to listen to different sounds. Just breathe normally. Good. Listen to your carotid arteries real fast. Okay, and if I could have you lie down. Good. We're going to do the same thing again. Any chest wall tenderness?
No, ma'am.
Okay. All right, just going to look. And same thing, just breathe normally for me. Good. Can you roll over onto your left side and scoot your body back towards me just a little bit? There you go. Just going to listen to your heart one more time. Again, you'll feel me changing pressure so that I can hear. Okay, you can roll back over. If you just want to stay on your back for me. Before I move on to the next assessment, I'm actually going to head and test your feet. Can you push down on my hands? Good. Pull back towards you. Very good. I'm going to slide these shoes off.
Okay.
Gonna check your pulses real fast. Gonna check your femoral pulses as well. Just pull your shorts down a little bit. Good. And arms by your side, please. Okay. Let's see your fingers here. And other hand. Good. Can you look that way for me? And turn your head the other way. Good. I'm just going to listen to your abdomen, okay?
Okay.
Listen to the arteries in your belly. I'm going to touch your abdomen a little bit. First I'm going to do it lightly, and then it'll be a little deeper, okay? You let me know if anything hurts.
All right.
Okay, a little bit deeper here. Just going to tap on you again. Any pain whenever I was touching your abdomen?
No, ma'am.
Okay. Okay. All right, let me just look at your legs real quick, make sure you don't have any swelling. Okay. All right, you can go ahead and sit on the side of the bed for me. Okay, we already tested your neck earlier, so I'm not going to test that again, but if you could bend your elbows up for me and then extend them. Good. And if you can do the same thing with your wrist, bend your wrist and extend them, and then turn them upside down and out, back and forth. Good. And for your fingers, can you bend your fingers and straighten them out? Bend again, straighten them out, and good. Can you squeeze my hands? Very good. Hold your arms straight out in front of you. Don't let me push them down. Okay. Don't let me pull them up. Very good. All right. So now what I want you to do is I'm going to touch some of your joints. I want you to tell me if they hurt, okay? And just let me know if there's any tenderness or anything whenever I'm touching. Let's see your wrist here. Okay, good. All right. Do you have any more questions for me today?
No, ma'am.
Okay. Well, this concludes our assessment. Thank you.
Thank you.
So now we're going to talk about how we would carry out the examination for the male genitalia. It is important to remember that whenever you're assessing genitalia of male or female, to make sure that you have a chaperone present. For males, you can assess them either in the standing position or in the supine position. The first thing that you want, of course, want to look at is the pubic region and note any kind of pubic hair, which should be coarse. That will narrow up to the midline, up to the umbilicus. After noting this region, you will start to assess the penis by inspecting it. You will look at the glands. Notice if the patient is circumcised or uncircumcised. If the patient is uncircumcised, you will need to retract the foreskin so that you can inspect the glands. At this point, you'll also look at the urethral orifice by taking your thumb and forefinger and opening that orifice, looking for any redness, irritation, or abnormalities. And after you're finished with this part of the examination, you need to make sure that the foreskin, if the patient has been uncircumcised, is then replaced. From here, you'll move to the shaft of the penis, where you will inspect it for any lesions. You also want to palpate for any nodules. You also want to strip the penis and making sure along the shaft, looking for any form of discharge that may come about. From here, you can look towards the scrotum, and you will want to inspect here, looking for color, shape, any kind of deformities in large scrotum. You'll also want to palpate the testes. You'll want to take your thumb and your first two fingers, making sure that you palpate gently. The patient should be able to not have a lot of discomfort here. They may be sensitive, but they should not feel discomfort in palpating for any kind of nodules. On the posterior lateral surface of the testes will be the epididymis, and you can palpate that there. Males, you especially need to palpate for a hernia. First way you would do that would to have them stand in front of you, and you would have them bear down. Now when they bear down, you may see that a hernia may protrude through the inguinal area. If not, then you may need to take your hands. The next part of the assessment will be to take a finger into the lower portion of the scrotum and pushing up in towards the inguinal area and feeling for that area there, and have the patient cough. This will help you to assess whether there's a herniation in this area or not. So now we're going to talk about the female genitalia examination. Females are usually examined in the lithotomy position, so you may need to assist your patient into getting into this position. Hopefully you have stirrups so that you can help them get their feet into the stirrups. You're going to start by inspecting the areas, inspect the labia majora first, and then you'll be able to inspect the labia minora by taking two hands. First one to separate the labia majora, and then the first hand to separate the labia majora, and then the second hand to actually palpate the labia minora. You'll be able to also inspect the clitoris, urethral orifice, and the vaginal introitus at this point. After you are finished with your inspection and have palpated the area for any lesions or nodules, you'll be able to assess the Skene and Bartholin's gland. The way that you do this would be to insert one finger and press forward with your palm facing upwards. And then you would actually be able to feel on both sides of the urethra and actually feel along the urethra, and that is how you assess Skene's gland. From there, you would actually palpate the vaginal walls and the cervix, and then you would come back to the Bartholin's gland. For your internal assessment, where you would actually use your speculum, you're going to use your fingers inside the vaginal introitus to insert the speculum comfortably for the patient. You'll ask them to relax. Once they relax, you'll be able to sweep upward into until you're able to actually see the cervix and visualize it. At this point, you'll need to position your light so that you can make sure that you can see and actually visualize the cervix, so that you should note the color. It should be pink. It should not be irregular. You should not see any lesions, but if you do, you need to note those, or any patchy areas. It's usually 2 to 3 centimeters in diameter. If the cervix is pointing anteriorly, it is considered to be retroverted. If it's pointing posteriorly, it's considered to be anteverted. And if it is horizontal, then it's considered mid-position. Any deviation of the cervix that you may see could indicate mass and adhesion or even pregnancy. You need to note the surface of the cervix. It should be smooth. Any other appearances should alert you to be looking for something. There should not be any malodor or difference in color to any kind of discharge, but note where the discharge is coming from, whether or not it's from the cervix or whether it's a vaginal discharge. At this point, a Pap test could be completed. After you have completed the examining the cervix, getting any specimens that you need, you can actually remove this speculum and get ready for your bimanual examination. During this, you will use both hands. One hand you will tell your patient you're going to insert 2 fingers, and then the other hand you would actually use into to the outside of the lower abdomen between the umbilicus and the symphysis pubis. Here you're going to be able to palpate the inside portions of the vaginal walls. You'll be able to test for cervical motion tenderness by taking the cervix between your 2 fingers, moving it gently back and forth, and the patient should not feel pain, but if they do, then they have cervical motion tenderness. From here, you'll want to assess the uterus. The way you do that is that you will actually press your hands sweeping and sliding downwards, while the fingers that are inside the vagina will actually press up and forward at the same time, and you'll kind of meet in the middle to actually feel the uterus. You want to note the size, you want to note the shape, you want to note the contour, and then you'll move on to assessing the adnexa. To do this, you will keep your hands in the same positions just like you would with the bimanual exam, except for you're going to move starting to the right. Your fingers will be at the right lateral fornix, and you will sweep the hand that's on the outside of the abdomen down to the right side while pushing up and inward to the right side to feel that in between motion. So you'll sweep downward with your hand, you'll push up and in with the fingers that are internal, and then you'll repeat on to the left side for the adnexa. A breast examination should also accompany your exam of the female and male patients. You want to assess the patients in multiple positions. For one, you'll want their hands above their head. This will help notice any kind of dimpling or irregular shapes or anything like that. The next one, you'll have their hands on their hips and rotate their shoulders forward. The third position is this here with your hands clasped in front. And then the fourth one, you can have them lean forward so that you can see from the sides and the front. Look for, again, for any dimpling, irregular shapes, irregular patterns. You'll want to start your breast examination with a chest wall sweep, where you're just sweeping down the chest wall in a continuous motion. And then you want to choose a pattern to utilize for your breast examination. So I like the circular motion pattern, where you just go in a circular methodical way, and you'll make sure that you don't miss any breast tissue, making sure that you are using a steady motion, never lifting the hand, making sure that you're encompassing all the tissue, looking for any knots, nodules, any kind of dimpling. Again, could also be a sign of, you want to check out for anything that could lead to breast cancer. If you do feel nodules, you want to notice their characteristic, their shape, their size. Are they mobile? And then if you need to do assess the areola, and you need to assess the nipples as well for any discharge, and note the size and shape of the breast. That concludes the examination of the female genitalia, male genitalia, and the breast examination. Next, we will move on to the rectal examination for males and females. You can do this in multiple different positions. Two positions that we've already talked about. One, the left lateral. This could be easy for males and females alike. Or you can continue the female examination in the lithotomy position. To do this, you're going to start by looking at the pilonidal and perianal areas. You want to look for any lesions, you want to look for any scarring, you want to look for hair distribution, and then you want to palpate as well. Next, you'll spread the buttocks apart, and you will look at the anus. You want to look for any hemorrhoids, tags, anything that could be out of the normal, if we can use those words. From here, you're going to inspect the anal area. Have the patient bear down for you so that you can assess the anal tone. And then once they relax, you'll take a gloved hand with some lubrication and insert into the anus. Have them tighten around your finger, bear down and then tighten, so that you can assess the tone of the anal sphincter. Once you rotate your finger after this, you'll be able to assess the anal ring. Insert your finger a little bit further to assess the rectal walls, and you want to be looking for any nodules. You want to notice any changes in contour that do not feel like they should be smooth. For males, on the anterior side of the anus, the rectum area, you will be able to feel the prostate, note the size and the contour of it. For females, you may be able to feel the cervix or the uterus, depending on the shape of and size of the uterus. Once you withdraw the finger, you will notice any stool that is on the glove. You want to notice characteristics and things of that nature. To do a fecal occult blood test, you will, they usually come with a card. You will take stool, place it onto the card. You'll use a developer onto that card that the stool is now on, and usually they turn blue, or what I'm used to, they turn blue. And if they turn blue, they are positive for blood. If they do not, then they're negative for blood. And that can help you know if there is any rectal bleeding, if there is any blood in the stool, which can lead to investigations of other malignancies or other conditions that need to be sought out. And that concludes the physical examination.